The Tulip is designed not only for ventilation but also for inline endotracheal intubation. If you introduce the Tulip in the normal manner, if you inflate it in its normal manner, you will have a controlled ventilating airway. So if you imagine that the paramedic does this first, and then the consultant anaesthetist arrives with a size 6 or 7 endotracheal cuff tube that is itself lubricated, you can intubate through the Tulip in such a manner. If I now inflate the endotracheal cuff, you will see that even blind intubation is possible. In a situation whereby a patient has a difficult airway, or in some form dangerous outcome potentially, we recommend that you intubate through the Tulip using a bronchoscope through the endotracheal tube, because that way you will not fail. You do not need a laryngoscope. On extubation, you're also then free to remove the endotracheal tube at the end of the operation and then facilitate a self-extubation with the Tulip when the patient themselves is awake. When the patient extubates, the patient is fully conscious. Laryngeal reflexes will have returned.